We've heard in the lead up to this hearing again and again that my colleagues, if nothing more than in their action, have indicated that it's okay for 24 million Americans to see their health care premiums increase by 2 or 3 or even 4 times. The defense of this is, and I'll quote one of my colleagues, is saying those 24 million people are just 7% of Americans. I suspect if you're one of the 24 million people experiencing skyrocketing health care cost, even financial ruin, that rhetoric doesn't really resonate with you. The people in my home district of Louisiana are, in many cases, hardest hit. Mr. Hemsley, can you share with me, there's the issue with this notion of step therapy, where a patient is forced to use a medication that may be a generic or may be something else that's used similarly, even though their physician has indicated they don't think that that's the best medicine for them. Should a licensed physician who knows the patient be trusted over an insurance algorithm when determining the most appropriate treatment, instead of forcing patients through a step therapy requirement that delays care and oftentimes increases suffering and even cost?
No, I think there are appropriate times for step therapy, but in the situation you describe, I would not.
And Mr. Joyner?
Yeah, I agree. Step therapy is an opportunity for one to introduce a savings opportunity for the consumer and member as well. So many
But
times they're
respectfully, oftentimes it's not a savings, it's a nuisance, because the physician is saying this doesn't work for my patient. Patient goes to the pharmacy and is told, you can't get this because the insurance company won't approve it because you haven't tried this. And the patient says, but I have tried it, it doesn't work, there are horrible side effects, but now I've paid a 30, a 60-day, 90-day copay for it, and they won't let me do it again. Isn't that unfair to a patient whose doctor, not an algorithm, but whose doctor has stated that this medicine doesn't work?
Yeah.
These are the kind of things that we hear from our constituents who are caught in the middle trying to get a medication to assist them with their ailment, but only being caught up in the confines or the clutches of bureaucracy within the healthcare.
Yeah, we completely agree with you, Congressman. In fact, if they've tried and failed, that's exactly where we want to engage and where we want to work with the provider on the appropriate therapy.
So is it fair from all of the companies, I got 7 seconds, fair from all the companies that you agree that this is an issue and that you will commit to working with us to be that buffer for the patient so they're not caught up in a forced step therapy when the medicines don't work, to overrule their physicians, but to listen to them? Is that a yes? Thank you.
I'm seeing yeses from everybody, and I appreciate those questions. I now look to